People with ADHD have substantially higher rates of substance abuse disorders and process addictions or behavioral addictions. Those can include things like gambling, gaming, shopping, overeating, pornography, things like that, scrolling on TikTok. So they are at higher risk for these things. A recent study came out and said they are 4.6 times more likely to struggle with substance addiction than people without ADHD. So if you have a partner with ADHD, that does not at all mean that they are going to struggle with addiction, but they are at a higher risk for developing an addiction at some point in their lifetime. Gottman Institute thinks of addiction as a third party in the relationship that introduces a lot of complications. It's definitely something that you want to have addressed by the person with ADHD so that they can evaluate if it has gotten to the level of addiction, if it's something that they can control and manage, or if it's something that is controlling them. The Dopamine Nation author talks about how pain and pleasure are co-located in our brains, and our brain loves homeostasis, so to keep things balanced, you think of it like a teeter-totter. If you tip it towards the side of pleasure through drinking, smoking weed, these different behavior addictions, then your brain will automatically tip you in an equal and opposite direction towards pain afterwards. So that might be like feeling anxious the next day when you wake up after drinking, or hungover, or guilty. So you end up having these negative experiences after in order to offset that in your brain. But one thing you can do to hack the system kind of is to do it in the opposite direction. So lean on the side of pain. So things like meditation, exercise, cold plunges, things like that that create a little bit of temporary pain will help your brain to also rebound in the opposite direction of pleasure because it wants to be balanced. One protective factor if you do have ADHD is to really manage your ADHD. A lot of people grew up with ADHD, didn't know, or they did, but they only really got medication management. But there are a host of other things that you can do to help you with whatever your particular symptoms are. They're different for everyone, but if you tend to be impulsive, if you tend to have struggle regulating your emotions, there's many things that you can do to work with that. For impulsivity, you can place barriers between you and the thing that you might normally reach for to make it more difficult. If you struggle with emotional regulation, you can work in therapy on that, on figuring out how to best regulate yourself when you might get emotionally flooded in a moment, and to find other ways to regulate your emotions rather than reach for a cigarette or a vape or something. There are many other things that you can reach for that will not be addictive, but that will still provide you relief. It may not be as instant or as powerful, but it's more sustainable.